Hello everyone, welcome to our webinar about persistent pain and movement and miscommunication. So I'm Emma Meehan and I'm part of this Somatic Practice and Chronic Pain Network. So we have a webinar for you today with lots of speakers and activities to participate in. So I'm just going to call on a few of my colleagues. We're all going to introduce ourselves before we get going. So I want to invite in Bernie, Sarah and Kozer so we can say hello and you know who you're talking to today. So let me see if we can get them up. That might take a moment. So yes. So just so you know, what my role is today is more like hosting the conversation. And I'll pass over to Bernie, who'll let you know who she is and what she's doing today.
Hi there, my name is Bernie Carter. I'm Prof of Children's Nursing at Edge Hill University, and I also work some of the time at Alderhay Children's Hospital. I've been working with Emma on the Somatic pain project for a couple of years now, and this webinar is one of our something we've been looking forward to doing for a number of months. So really glad that we're doing this today and welcome you to our webinar.
Thanks, Bernie. And Bernie will be presenting later as well. And Sarah, do you want to say who you are and what you're doing?
Hi, I'm Sarah Charles. I have been working with the network for the last couple of years as an administrator, but I've also completed my PhD at Coventry University in psychobiology, and I'm interested in neurochemistry with an interest in pain. So that's where my stuff comes in. And today I'm going to be in the chat just talking with people. If they have any questions, you can also use the Q&A. And so if you want to just chat and talk to each other or just say pleasant things or congratulate anyone on their talks, put that in the chat. If you have any direct questions for any of the panelists, use the Q&A and then I can direct it to them, and it's much easier to direct that way.
Brilliant, thanks. And Kozer?
Hello everybody, welcome. I'm Kozer Hussain. I work at Coventry University as a Research Delivery Support Assistant. I'm helping Emma with the delivery of this project and webinars.
So I'm going to say a few kind of arrival notes about what's happening. So you guys are welcome to jump in if I miss anything. The webinar is being recorded, just so you know, and so that the chat and questions will be visible in that. So if you don't want to participate in that, that's fine. Just to remember as well, there's options for you. You don't have to be glued to the screen all the time. So feel free to step away, lie down, sit, listen, do whatever is best for you. Yeah, I think with the chat, some people really like to be participating a lot and some people find that overwhelming. So it's up to you. Again, you can just switch off from that if you want. And I think that's all. Is there anything else, Bernie, was there anything else about guidelines for watching or listening? No.
I think it's just keep yourself comfortable and keep yourself safe, and enjoy. So if anything just feels not quite right for you, then dip out or do what you need. Let us know as well.
Yeah. And anything else, Kozer and Sarah? No. All right. Well, I'll say goodbye to Bernie, Kozer and Sarah because I know you have other things you want to do now. And I'll just say a little bit about the theme of the webinar today. So, and I'm going to turn off my chat so I'm not distracted. So the theme of the webinar is around communication. And that came up a lot in our discussions in the network. And it comes up a lot in the literature around persistent pain. The challenges of communicating something that's sort of deeply embedded in your body and mightn't always be visible to other people. So the challenges might be around communicating with healthcare professionals or with family members. or with other like complementary practitioners like dance artists you might be working with. I think one other thing that came up in some of the things I was reading was people's sort of concern that they had to perform a certain level of pain in order that people might believe them, or for it not to appear too much that people felt burdened by it. So that was another concern. And there's been quite a bit around different arts practices where people use like poetry or sculpture or painting to communicate pain experiences. But I think there's a lot more could be done around dance and movement. So that's what we're interested in today. How the moving body tells us something about pain experience. And then just from my own perspective, I kind of had to ask the question, what does the word communication mean to me? And in terms of the kinds of movement work that I do, I felt like it's more about digesting information, noticing what my body experience is, and then being able to articulate that. So I think we'll have a bit of a discussion today as well around, you know, how people use that word communication. So some of the aims today are about exploring this topic, providing different perspectives from health or arts or lived experience, sharing ideas and practices, and then kind of offering dialogue with the participants at the webinar, which is you. So we hope you enjoy that. So I think what I would like to do first is to invite Rob in to the video, because Rob Young is an artist and a writer who actually works with the NHS in the area of communicating, and we've asked him to do a series of prompt films, and these are to invite you as participants to reflect on your own experiences of these themes. So I just wanted to invite Rob in, if his video is on. There we are, Rob. So before we share one of the prompt videos, I wondered, is there anything you wanted to say about them?
Yes, welcome everybody. I think what I'd like to say is that rather than just say, let's talk about this, we thought, as there's lots of creative people in this group, let's do something creative to start the conversation off. But with pain, it's unique. You know, you can't compare or contrast or examine or weigh it or see it. So how to portray that visually. And because everybody's pain is unique, the little films that I've made won't work for everybody, because, you know, your pain might be yellow or blue or brown or white or mustard coloured. So it doesn't really matter if you don't like the little 1-minute films. That's part of generating the discussion. So sort of, you know, this is one person's version of how, as a former child in pain, I might communicate pain, but yours might be completely different, which is fine. So it's just a sort of almost like a goodwill gesture to start things off creatively of how we should talk about this. And hopefully between all of us, we'll come up with some positive solutions.
Brilliant, thank you, Rob. So sorry, I have sunshine coming in, so I'm just going to stay sitting back here. So I'm going to invite Koser to set up the first film prompt, and basically the idea is just to reflect on what brings you here today, and you can write some notes in your own notebook, or if you prefer, you can drop it in the chat as well. So I'll let Koser set that up. So thank you. I'm going to start my video again. There I am. So thanks for watching our first kind of film prompt by Rob. And it's a chance now, just give you a moment if you want to write down some words in your own journal or in the chat about these words and what brings you here. And yeah, you can take your time with that, and we can return to that later. Right. So great. So the rest of the kind of morning, we're going to continue on until 11, and we're going to have short presentations from a series of presenters who are going to share different perspectives on this theme. So the first one, we're going to invite Anna and Kerry to join us. All right, and so just a bit of intro while Anna and Kerry are getting their video on. Anna is a lecturer in performance, and she's a somatic practitioner as well as a filmmaker. And Kerry is a lecturer in literature and creative writing. And they've both worked together on this project called Circling with people who live with pain. And Kerry also has lived experience of pain, which is important. And I think I was really interested to invite Anna and Kerry to share their work because it was slightly different from other things we had shared before. And it was more doing this work in an artistic context rather than trying to do a kind of health intervention or something like that. So I thought that was really interesting. So I'll let you share your slides and talk for a few minutes about your work. Thank you.
Thank you. Thank you very much, Emma. Yes, it's so lovely to be invited here, and thanks to Rob for that video that's just set me off nicely. I can really feel that. It's ever so helpful seeing before we speak. So this project, as Emma said, is an arts project, and it was looking at pain, and we were working with people with health conditions that cause them chronic pain. But we were focusing on the movements associated with pain, so the roots, the pathways, the journeys that were involved in living with persistent pain. So in some ways, right from the beginning, we were what we think of as aiming from the side. So we weren't focusing directly on the pain, but more how that pain affects the way people move through life. So, but obviously doing that then reveals something about the experience of pain. But we avoided working very directly with the question of how do you communicate your pain. We worked with participants for, it was over the length of a year, and we met and we brought together two different processes. So it was a pilot project really to see how these two creative ways of working might work together. So we were bringing somatics together with geopoetics, and I'll leave Kerry to maybe explain what that is. And then that work with the participants, that creative work, then fed into the development of an exhibition of screen dance work, moving image work, looking at movement on screen, called Circling. That exhibition was up for exactly 1 week before lockdown, and then about 3 months it was in the gallery and no one was allowed to go and see it. But we were lucky enough to get some funding to reimagine it for an online version of it called Circling Again. And yeah, I'll just move on now to this next one. And Kerry can tell us a little bit about where we began.
So as Anna highlighted, the project drew on both of our practices, and some of you are unlikely to be familiar with Geopoetics because it's only really sort of taken off in this country quite recently. So Geopoetics, to summarize widely, is a kind of site-responsive creative practice. So despite poetics being in the name, it's not only used to refer to poetry, but to a range of artistic and creative practices, but it's always to do with place. And one of the reasons why Anna and I decided to work on this project together was because we both done work on place and walking. And when I use the term walking, I use that term in an expansive sense. I don't mean it just to refer to a bipedal practice. So I draw on the work of Sue Porter to think about walking in wheelchairs with prosthetics, with other walking aids. So thinking about communication in preparation for today, we also had to start to think about how we would communicate together across different disciplinary backgrounds. So we began with 2 walks. And during those walks, we discussed some of the issues that we thought would be pertinent to the project. So we took the same route twice over on Keele campus and talked about things like walking and mobility, how we understand terms around related to those, the spiral or circling or repetitive nature of persistent pain, and some of the things that we could do with try to create some space within those circles and cycles, turning circles into spirals. And I think Anna will talk a little more about the next stage.
Yeah, so I was lucky enough to get a fellowship, an arts fellowship with the Institute of Liberal Arts and Sciences at Keele to work with Kerry. And as part of that, I got access to a lot of the pain professionals working at Keele. So I began that work with a series of interviews, quite long conversations with pain specialists, talking about their approach and talking about particularly about movement and pain and how they consider it, how they talk about it, how they work with it in their practice. And that was really really fascinating, really thinking about how pain that returns, pain that stays, operates within systems within the NHS, which are often set up as something linear or with an endpoint, a point of resolve. So how do we work with something that doesn't resolve and isn't going to resolve? How do we work with return? And that really fed into thinking about points of contact with pain professionals and the points in between the points of contact. How do we sit in those spaces in between? That was something that we began with. So lots of spatial metaphors, lots of movement metaphors that were into the planning of the work with the participants, where really we moved between our practices. So I might begin with a series of somatic tasks, maybe thinking about things like how do we think about moving not from endpoints in the body, so for avoiding endpoints or avoiding maybe joint points, so moving from somewhere in between. So might we move from in between the fixed or free points in the torso or fixed joint points? Might we move from fascia rather than from joints? Might we think about places in between? So we might move from A to B, we identify A and B, but we stay in between. And Kerry had a series of geopoetics prompts, often working around the act of walking, which I'd say were more open than my prompts and created a different space for participants to reflect on their experience of moving and living with chronic pain, and often working inside. So I would work inside and Kerry would work outside. Do you want to speak to that, Kerry, or shall I talk about?
Well, maybe I'll just say something a little bit more about this with the construction of the workshops, and then you can talk about the film. Yeah. So, as Anna said, it was a pilot project. We were kind of feeling our way as we went along. Anna had experience of working with a whole range of publics. I'd done some participatory work before, but not usually with people working on things that might have been particularly difficult for them to talk or write or draw about. So I was really drawing on Anna's expertise here. But often the workshops that we did with the participants, we had 6 participants. We were aiming for 2 or 3, we had 6, one of whom always participated at a distance because prefiguring, you know, our current COVID participation. So she's an expert in that field now because she's in Glasgow and we were based in Stoke. And we often paired what Anna would call scores, like somatic score, with a geopoetics prompt. And as Anna said, you know, much of the somatic circles took place indoors, but much, not all, but much of the geopoetics work took place outdoors and involved people trying out different textures and thinking about being in the outside space, I suppose. And I'll talk about some of the work from the next stage now.
Yeah, I'll just come out of this and show a little bit of. Now, can you see the screen of the film? No, I'll stop and then I'll share again. Okay, here we go. So this is an extract from a moving image film, a screen dance film. I made these with the participants, drawing on the ideas that had come up around space and movement and living with persistent pain. And this created a series of about 10 films, which were shown in an exhibition. And this one was performed by Emma Henderson, and the writing in it is hers. Just going to stop that there. So I know that we're probably at time now, but we were very interested in expanding spaces. So going into them, thinking about how space might be contracted by persistent pain and going into those spaces and using the practice to expand them. I was very interested in revealing something about the extraordinary kind of choreographic capacity of Emma, say, in this film, to negotiate multiple points of support, to navigate her kitchen, the skill involved in that work that doesn't get seen or is seen perhaps in not in its creativity, not in its artful, extraordinary, delicate mapping of weight and structure through her spaces. And but also in avoiding narratives of before and after. So Emma used to snowboard. She feels she probably could still snowboard. And so we kept the sound of the snowboarding over the images of the stool being moved to try and kind of collapse a simplistic binary before and after. So I think we're probably at the end of the time there, aren't we?
Yeah, thank you. I'm not sure if you can see me, but I'll maybe ask you a question. So thanks for that. Yeah, I just think it's really interesting that you're highlighting the skills of people who live with pain to navigate space. And also, I don't know if you or Kerry wanted to say something about communication in this context. Did that word kind of work for you, or would you say your work with people and the films that a different word would be more applicable?
Anna, do you want to just pull the slides back up a second?
Yeah, sure.
There are a couple of quotations just on the final slides we didn't quite get to. So in terms of responses from the participants, a key response was that they were delighted not to be talking about pain, to be in workshops that weren't asking them to focus on their pain and talk about their pain. But they were also quite surprised, and as one participant quote shows here, about how much they enjoyed sharing their experiences with the others, whilst recognizing that each experience of pain is very different from another, and that, you know, it's impossible to entirely empathize or share. And just in terms of community, can you go to the last slide as well, Anna, please? And yes, and these are some responses to the online webinar event that we put on once the in situ exhibition was no longer possible, really. And thinking about communication, some of the responses from audience members did sort of suggest that the project helped, because one of the aims of our project was to try and get other people who might not experience persistent pain themselves to have some kind of awareness of what it might be like, or just to rethink about notions around ability, disability, and so on. And you've just got one or two quotations that might suggest that we had some degree of success in that. So having never experienced chronic pain, it gave me an understanding that I would not have otherwise gained.
So a lot of the artworks were really looking at that kind of affect of chronicity. So they were absolutely ongoing, 24 hours a day, continuously moving, images of cycling, circling, returning. They were quite relentless. They're kind of to look at and to sit with and stay with. So there was something about trying to generate that. And maybe the word, when I was thinking about communication, you know, it feels as communication feels as if there's a singular thing, and that if I do a good enough job as an artist, I can communicate something. And that feels too reductive, you know, to the variety of experience, and the changeability of experience is not going to be the same thing there's one thing, you know, that it's very mutable, that each day is very different, and there's continuous creative adjustments that the participants were making. And so I think probably for me as an artist working in this area, the word, revealing or throwing some light on, or, like something transitory that I can kind of open a window on that day, but not communicate something singular.
But
Yeah.
thinking about the exhibition more broadly, because the films were also accompanied by quotations from the participants and some of the participants' artwork that they produced in relation to the Geopoetics prompts or scores. So there was nice communication between those various artworks. I think we've seen some of the quotations from the creative writing, but there are also drawings, sketches, photographs, that some of which were curated as part of the online artifact as well as the in situ exhibition. So there was communication between those various artworks as well, I think.
All right, okay, yeah, that's a nice idea. Well, thank you very much. We'll come back to you again later. So if people have questions for Anna and Kerry later, please do put them in the Q&A. And now I'm going to call up our next presenter. I'm not sure if you can see me because I can't see myself right now. But there's Bernie. It's going to be our next presenter. And Bernie is a professor of children's nursing and works with children and their families, and has many projects around using arts practices and communication. So one is communicating Lily's pain. So I'll let Bernie share, or I think Koser is sharing Bernie's slides, and I'll let you get on with it.
Thank you. Okay. So although I do an awful lot of work with different artists and with different disciplines, I guess today's small presentation is focusing on some of the things that perhaps closer to home to me and the children that I often work with, the children and families. So in some ways, I'm not actually representing healthcare professionals because that's a massively diverse population, but I'm perhaps thinking about communication in terms of people with pain, children with pain, parents of children with pain, trying to explain their pain in clinical consultations or at points in time where the time frame is really short, and perhaps that focus is a little bit more clinical. Okay, next slide, please. So this actually kind of serendipitously moves on quite nicely from the previous presentation, because communication about pain is often seen to be about talking, and perhaps that is what is given precedence within clinical situations. But we all know, anybody that's experienced pain or has been with somebody that's experiencing pain will know that communication about pain is way more complex than that, but also much simpler than that. I think sometimes, especially within healthcare, if we say something is terribly complicated or very complex, we can absolve ourselves from responsibility for getting things right or improving things. And sometimes we just need to stop and listen or look. So core to many aspects of people's pain experiences are things in terms of describing their pain or attempting to describe their pain, sharing their pain, even if that's just through touch, seeing, looking, listening to people's pain. For nurses and for other healthcare professionals, assessment of pain is kind of a core responsibility. If we don't get that right, we don't get very many other aspects of pain support, pain management, pain supporting people's self-management right as well. There's explaining what's going on, informing, supporting, coaching, comforting, validating. The list goes on. I kind of stopped after that, but it encompasses a whole host of experiences and ways of engaging with people. We know that people who become specialists within an area become very skilled and become quite intuitive, perhaps, in the way that they can communicate with people in pain. but even those people that are perhaps reasonably expert can go wrong, can communicate in a way that the intention was good, but the way in which what they've said has been received by the person experiencing pain, it feels wrong to them. So I said earlier on that most of the research work that I do is with children and their parents. Okay, next slide, please. And I came across this myself because I was working with a medical student from Canada, giving her some support, and we were looking at a very simple assessment of pain. And I know for anybody who experiences persistent pain, being asked to use a scale perhaps minimizes what's happening, but within practice, sometimes these scales are still, well, these scales are often still used, and they have some validity. And I'd spent years talking to children about these scores and asking them to score their pain on what I was calling a 0 to 10 scale. And it wasn't until I was talking to my medical student colleague that she was going like, why aren't you saying 0? And I went, because I say 0. And then when we started talking about it, and I started talking to friends, and I started asking them to talk to children, their children, and ask them what number, how they would say that word. And we talked to a whole bunch of healthcare professionals. Older healthcare professionals used 0, younger ones used 0, and all of the children used 0, and were taught 0 in schools. So even in what is a really simple tool, we sometimes use the wrong word. So I now have to remind myself that if I'm using what is still in my head a 0 to 10 scale, it's actually a 0 to 10 scale, because a lot of the time the children wouldn't necessarily have understood what 0 meant. Next slide, please. Some other work that I'm doing with young people and families where the young people and children are experiencing persistent pain is looking at reassurance. And again, reassurance is something that is used quite typically within healthcare professional practice when as a means of trying to show that human side or presenting some level of empathy for people. But what we have to remember is that the words that we use create images and can create threat. So for a long time within children's practice, if a child was going to be having perhaps a potentially painful procedure, or we were perhaps doing a dressing change or something, we'd often say things like, oh, don't worry. So for a child that perhaps wasn't worried, being told not to worry immediately makes them think like, well, what would I be worrying about? What should I be worrying about? What's going to happen? So things like don't worry are now considered to be kind of like empty reassurance. And similar things in terms of reassurance by healthcare professionals to adults presenting with osteoarthritis will often reassure the patient that don't worry too much, it's just wear and tear. And the problem with saying something like wear and tear, which is perhaps an oversimplistic description of what's actually happening to their bodies, is it can make people think, well, actually, if it's wear and tear, maybe I won't use that so much, I won't put so much weight on it, I won't use it so consistently, because I'll stop the wear and tear happening and I'll make my hip joint sort of last for a bit longer. And actually that's the exact opposite of what most health professionals would want people to be doing, which is to continue to move. So what we have to be really careful about when we're communicating about pain with people is that our reassurance is informed, informative, positive, and not sort of just empty. Next slide, please. So in the study that we did with young people, or children, young people, parents and nurses, we were interested in how nurses directed or used reassurance and who they directed it to. And we found that with the most skilled nurses, that they were able to direct particular types of reassurance skillfully to either directly to the parent when it was necessary to support the parent, directly to the child, and that wasn't always through using words, that was through language, gesture, getting down to the child's level, creating a sense of ease, acknowledging any of the child's fears, and then doing something, providing reassurance where it was directed both to the child and parent. And for the children who had persistent pain, one of the key bits of reassurance that was core to all of their consultations was acknowledging that the child's pain was real and believed, and taking notice of the child and family's particular circumstances to present solutions that were both practical as well as reassuring. Next slide, please. We've talked a little bit about how language can create either threat or concern, but quite often when the parents who I work with whose children have profound cognitive impairment, so that the children are unable to communicate verbally and have very limited means of communicating. Quite often the parents find that after they've come to the end of all of the language that they can possibly use, that they're talking figuratively. And I know for many people with persistent pain, they will best sum up how they feel, not in kind of like clinical technical language, but in the impact it has on them. So for parents of children with profound cognitive impairment who may have really very severe pain and quite a high pain burden, may present at the emergency department looking for support and pain relief for their child. And when they're trying to convince healthcare professionals that the child has pain, some of the phrases that they may be using are things like, she's got a look in her eyes, which doesn't necessarily make sense to a less experienced healthcare professional. But if they take time to look at the child, you can literally see the pain, almost literally see the pain in their eyes. Or one child whose hip had come out of its socket, which was the reason for the child's pain. His mum was saying his hip feels really crunchy, and the doctor she was saying, the doctor said to me, well, what do you mean by crunchy? And she was sort of saying, well, put your hands on his hip and you'll feel it. So parents and other people with experiencing persistent pain have to explain the unexplainable. Next slide, please, Kausa. So if anybody's interested in learning a little bit more or coming across a little bit more about the work that I've done with children with profound cognitive impairment, we've got 2 information sheets. The animation Communicating Lily's Pain, which has been developed with huge amount of input from parents. And there's a QR code there, which will take you directly to it. Next slide, please. So in terms of this being pain and movement, I was thinking about this in terms of children and adults who have persistent pain do experience or can experience pain from moving. And that's either it's the wrong type of movement for them, there's the fear associated with movement, people develop a lack of trust in movement and become disinterested in movement. And we know with children who are on waiting lists to see chronic pain specialists become increasingly immobile in that period of time. And one of the first things that the multidisciplinary team will do will be to try and re-engage that child in movement that is felt to be valuable and worthwhile to the child. So that's pain from not moving. And there's also a whole heap of children that we're working with at the moment who, because they can't move, they are pretty immobile, they depend on parents. They're poor, unless they're taught, parents are taught how to position their child. The positioning that a child is in a wheelchair or in a seated chair or at night can lead to really poor positioning, contractures, and that leads to a lot of increased pain burden for the child. But there's also moving without thinking about pain, which is one of the things that can be achieved. and I worked one summer with some physio students and some colleagues and an absolutely brilliant mum with a wheelchair sports club for children who had disabilities, as well as children without any disability at all. And the idea was that you could engage in the sports practice, providing you were in one of the wheelchairs that we provided, the sort of the sports wheelchairs that were part of this club. So if you look at the next slide, please, Kausa. Over the course of something like 12 weeks, we went from some of the children who had disability being worried about engaging in sport because they rarely got the chance to do this at school because they were often on the sidelines. We got children who were able-bodied, and that was the wording that the children decided to use, the able-bodied children, realised how much hard work it was to actually push a wheelchair around and how skilled the children with disabilities were. We had a whole range of stuff, and we did some very small amounts of measurements and assessments to see whether or not the children were stronger or felt stronger, and every single one of the children came out of this very creative and fun sort of set of events feeling stronger and really enjoying it. And I think the tragedy is there's just not enough opportunities for children with disabilities to actually move and get stronger and reduce the pain that they perhaps were experiencing. I think that's probably my time, and I should stop, but I haven't got a watch on, Emma, so sorry.
Thank you very much. That's great. Can you see me? Or
yes,
you can. Okay,
I can. We can see you all the time at the moment. You're never off screen. Well, yeah, when the screen's like this.
So that's fantastic, Bernie. And I think Sarah might be just Rob has just shared the Communicating Lily's Pain video link there, and I'd really recommend people watch it. And I think what really struck me about that was sort of the role parents play in attuning to their child. So there's like communication coming at some very deep felt level between the parent and child. But then I was thinking that must also be happening with very experienced healthcare professionals, and also with somatic practitioners as well, as they work with people, that very deep felt sense attuning, that's a form of communication. So I found that really interesting about the Communicating Lily's Pain animation, you know. Yeah, just to get a sense of that, you know.
I should have mentioned that Rob Young was he was our writer with the script on the Lily's Pain work.
Brilliant. So thanks, Bernie. And so if you have any questions for Bernie later, please drop them in the Q&A. And so I'll say goodbye to you now, Bernie, until later. And
thank you.
We're going to invite Toshio Nomura. So we're a little bit behind. So we were to take a break at 11, but it might be slightly later. So we understand if you need to take a break, but if you're happy to stay on, that's great. So Toshio is a professor at the Faculty of Health and Life Sciences at Coventry University. And we had a lot of conversations around, you know, how pain is deeply felt and how that can be communicated between the practitioners that someone who lives with pain is working with, and different sort of visual ways of sharing that, and also the cultural dimensions as well. So, and Toshio also has experience of pain as well. So I'll hand over to you, Toshio, for your slides and provocations for us today.
Okay, thank you, Emma. You can see the picture, right? Presentation. On the
see the presentation, yes, no?
Yeah, okay. So on the first page, just I added systems approach. Okay. And this is the background. I'm sure that you know about Emma.
Sorry, Toshio, sorry to interrupt. We can't see your screen share yet.
Screen share. Do I have to screen share? All right?
Perfect, thank you.
Okay, thank you. So I already mentioned the front page, page 1, I just added systems approach, a little bit different from other speakers, previous 3 speakers. I'm sure that you know about Emma, so I explain a little bit, just a 1 minute talk about myself. I have no background in somatic practices and dance. The background, I'm the scientist, so basically science and technology, and I have done quite a lot of R&D and commercialization activities. And then fourth one is I added just systems thinking, creative problem solving, KJ Ho. You might have read or seen the article which we wrote in Emma's blog about this KJ Ho in terms of somatic practice. So if you're interested in, please read this. And the most important, my contribution is this, the last one. It's a chronic pain on my left leg. This is after getting shingles on my left leg in the past 2.5 years. And still, it's painful, pain is quite bad. And every day and night, I have to do something, I'm quite aware of that, without taking any medication. So that's myself. First page. I wondered what to do, but anyway, I'm sure you have seen this type of presentation before. This is coming from the software engineers, how to get requirements from the client. I'll give you some time to look at. Top left is the how customer explained, right? And right bottom is eventually what the customer really needed. The question is how to connect the first one to the third one and the various lessons which we should get. The first one, customer really doesn't know at the beginning what he or she wants, right? People think that they should know, but they don't until you have to go through the certain process. And the final result could be quite simple and quite different from what the customer said. And in between, there are many, many funny pictures. But depending on your position, for example, sales executive wants to give the very comfortable solution. And this the customer was billed. It's a very expensive fun ride of things. And the help desk, suppose almost nothing and charging money type of things for this. And it's quite interesting, and it's a good lesson to learn from here. And the next picture is our domain, chronic pain, healthcare specialist, a professional, and the somatic practices. And then today's topic is miscommunication, lack of communication, misunderstanding, all those things, how to combine these things. So from the previous page, first page, or second page, and this page, I came up with 3 blocks which are reasonably significant. And I wrote the systems approach. First approach is how to present or how to describe the chronic pain beyond plain English. People assume that everybody in the world speaks English and everybody understands English. Even the cultural background is different. But so I start putting questions here, and simply it is not the case. A second one, which I extracted as one big component, is how to share whatever you found represented with a health professional. So basically, you think that if you talk in English and then people understand and they share the common concept, but actually not. And how to share is a very important component of today's discussion. And third one is, say if you can share, suppose Somebody both said, yes, that's the right thing. And how to connect to the somatic practices or movement and dances. And then after talking to Emma, there are two separate objectives, if I may say. The first one is articulating pains itself. Those two things will give how to describe, articulate, and those things. Second one is, no, so we're trying to solve the problem of the chronic pain. And this is a slightly different thing. And so I put them representation, how to share between partners or so players. Third one is how to reach, how to relate to the solutions or articulations type. This is the one. With various angles. First, and then today's talk, obviously I can't explain everything. And I've just thought about these things in the past months or so after talking to Emma. So today I just talk about this, how to represent or describe the chronic pain. First one, I'm Japanese. My education is all Japanese. I left Japan when I was 30, and more than half of my life is in Britain or in the States. But I thought that it gives you here, those people who are here, quite good discovery. Not everything can be translated. Okay, left side is so you're sort of, if you become slightly well aware of the English itself, you can use these separate terminology. But mainly these are for noun or verb. And unless you know the word, you can't do much. So as a foreigner, say for a Japanese person who can't speak English much and go to GP or pain clinic, for example, how to describe your pain in English is such a hard work because you don't have the terms. Because in Japanese, pain is almost always, or just a lot of time, adverb, right? So and just there's a word called pain, obviously, itai, because it is painful. I can choose zuki-zuki here. Zuki-zuki is a more like repeatedly, jun, 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 but not a throbbing type. Similar to sort of zuki-zuki is zukin-zukin. This is in synchronizing with your heartbeats. Zukin, zukin, zukin. I have zukin, zukin pain, right? Pili-pili is almost, you can feel from the spice. It's quite sharp, spicy pain. And kirikiri, I don't know whether you feel something, but the kirikiri is a sort of very sharp pointing knife is touching your skin type, pili-pili. And so I wrote this pair. These are not exhaustive in some sense, but particularly in Japanese case, Japanese have a lot of these terminologies, even for raining, heat, and this is a pain. But can we translate? Perhaps not always. Sometimes you can find the counterpart, but generally speaking, not. So I introduced a little bit about onomatopoeia. The Japanese language is more like onomatopoeia, full of these things. Onomatopoeia is a sort of metaphor that mind, and it resembles sort of sound that it describes. So in Japanese language, pain is almost about the sound. That's very strange, but just we are brought up to describe your pain as in terms of sound. And the third point is that just Emma said that pain itself is quite universal across humanity. but it is not universal over various cultures. You can't translate so many things. So that's the point which I wanted to explain. And from the linguistics case, I sort of have shown it. So if you can't do that by language or linguistically, what do you do? This is like emoji. Just for the sake of discussion, emoji means a is a picture. Moji is character. So emoji is a character, no, picture character. And that is Japanese. We have used it for many years, not recently only. And then some people have the different interpretation, just like karaoke. Kara is empty, oke is orchestra. So karaoke is empty orchestra. It sounds funny, but the orchestra without any main singers or players type. But the emoji is a picture character, picture based. And opposite way of saying it is that the Japanese character, particularly based on Chinese characters or emoji in itself. So it's nothing new about it, but nowadays you can describe these things all the time. And I put the pain scale, as you know, this is quite often used for those like youngsters, those people who can't communicate much, or who are lying down all the time and you can't use hands even. And but as I said, that pain itself is quite not universal in terms of cultures. And say in Japan, that to say that I have the amazing, this one, unbearable pain, it's not the polite thing to say. So even you have this one, you may say in the second or even the third one, because it's quite good that you can bear the pain. And so that relates to so many things in Japan, but even the pain killer, how they describe is quite interesting. They use more like cartoon rather than medicine or medical description. So anyway, the pain scale is quite individual, and then also depending on experience of the person, and then where this person lives, in the middle of the war zone or in the middle of the desert, probably it's quite different. So you can't translate, but in a limited area of the same similar sort of pain, if you like, it's quite useful. So next one is, this is emoji, but it's a static emoji. But as you know that you can move. So animated, this is a GIF, but animated emojis. So it's all about migraine. And certainly it's a migraine in these 4 of these. It's a little bit far more, or a little bit more expressive than the static emoji. But after looking at these, and I'm sorry that if you have the migraine just now or last week or so, you may feel quite good, but after looking at these things, don't you think something is missing? What is this sounds. If you can add sound to the sort of moving picture, and sound is not this person shouting or screaming or type, but some onomatopoeious description, like Japanese sound, Japanese description of the pain comes as in the background. I think it becomes quite more expressive, right? So this is the last slide. I started with 3 blocks of things. One is a representation. Second one, how to share that representation so that both sides or 3 parties understand, accept, agreed. It's another trick to go through. The third one is how to relate to the somatic practices, is the third one. And then I did just explain just my initial thought about number 1. English, say, or language, itself is limited. Drawing is quite often used. A picture or emoji itself or animated one is more. But if you add appropriate sound, not sound of pain, but the pain sound which comes from pain. And I was thinking of Japanese, but it's quite good way of representation if you have these tools around. And on top of that, the culture is, like I said, Japanese, but Japan or Japanese, where the pain is not something to talk about. So you rarely talk about pain in the public place, or you don't show your painkillers in your bag, but it's a little bit more private part. So you say, oh, it's okay, it's not too bad. And personal histories, if you have gone through the pain, or if you have some pain, versus those who don't have, it's a quite different way of representing things, and the gender, obviously, and then family, and then a few other things. But there's a sort of collection of something which you can represent the pain. And I'm not aware of this, but just that's it. So the number 2 is how to grow these things between players and all accept. This because I should have mentioned, but in the first swings drawings, didn't you wonder why they didn't talk properly, or why didn't they try to share the various people's ideas before moving to the delivery of the system? So this is the number 2, and this is not the one step, as you know. You have to go through various steps of agreeing. In the swings case, drawing is one thing, but the objective until the end, the finance becomes sharing means. And then 3 is also delivery of that for various purposes. And that's it. Thank you very much.
That's great. I like that. Represent, share, and connect. And you've just shared so many important questions around the cultural aspect of pain, and how comfortable people are also with sharing their pain experience, and then how it gets represented. So I'm just aware we've gone over time. So if you have some questions for Toshio, please drop them in the chat during the break. If you're okay, we might come back at 20 past, which is a shorter break, just because we've quite a few other things we want to do. So we want to talk with the panel on the themes. We want to hear your questions and comments. And also we have another prompt video from Rob. So thank you all, and I'll see you back here at 20 past, and feel free to also drop in the chat about your own research if you have anything you want to share there as well. All right, see you at 20 past.
20 past.
So welcome back again, and hope you had a bit of a break. The rain is starting to fall now, so you might be able to hear that. So just to welcome you back, we're going to have another of Rob's prompt videos. And this one is just to sort of take in and digest what's happened and see what your response is at this point in time. So I'm going to ask Koser to put on that video if you can. I think this one has sound as well.
Notice your breath, your heart rate. Make yourself comfortable, whichever way works for you. So shift position if you need, or wriggle, reach, touch, release. Rest your eyes, your jaw, your neck for a moment. Take time to digest what you have heard. How do you feel now? Is there a sensation, a colour, or a word that sums up how you feel?
So just a moment for yourself to take a note in your own journal or in the chat. What's staying with you now. So the next part until 12, we're just going to spend with the whole panel. So it's an opportunity to ask your questions and also an opportunity to reflect on the practice that we shared in advance. So if I might ask all of the panel members to have their video turned on. We get everyone back now. And Sarah as well. We can have Sarah. Is Sarah there? Yes. So I might ask Sarah just for a moment, maybe can you do a little recap of what you might have been seeing coming in on the chat and any important questions that are coming in?
Yeah, so there's quite a few different comments that we've had over the course of the last hour and a half or so. So if we go back to the beginning, some people mentioned that they enjoyed the kaleidoscope image of pain that came through in the first video prompt. Others have mentioned how it's interesting that there's a cultural dimension that they hadn't necessarily considered when they're talking about Toshio's work. Other people have been asking questions about the circling practice. So there's lots of stuff going on about all of the things, and it's really interesting to see Bernie as well interacting in the chat and discussing with people some of the things that they've been asking of her. And there have been some questions that have come through that Anne and Sari and I have been trying to answer as well. So there's a lot going on, and it's really exciting to see people being so engaged.
So are there any outstanding questions that we should pose to the panel now?
Yeah, so one of the big questions that has come through are people asking about mental pain. So kind of discussing how mental pain works and asking if there's been any done on working on not just physical like body pain, but mental pain as well.
Okay, great. So I don't know if anyone from the panel wants to comment on that. Has it come up in your work, the kind of the kind of facet of mental pain that might also go alongside the physical pain as well. Any takers on that one? Bernie?
I'll say a small thing. I don't think you can have a physical pain experience without some component of mental, sort of social or emotional pain. I think the two are together. I think, well, from my experience and the way that most people are talking about it these days, I think what tends to happen is people are asked to focus on the physical pain because that's the bit that perhaps is easier to unpick. You know, take something, do something. I think the emotional pain is there for as an integral part of the experience. And certainly for the parents that I've worked with, they have a lot of emotional pain that is tied up with witnessing their child's pain. And I think we see that where there's couples or within families, you know, people who are concerned about other people in pain, or, you know, have an emotional pain relating to your friend's persistent pain experience. So I think persistent pain particularly kind of is something that impacts a lot of people around you. However much you try to contain it, there will always be some sort of notion of other people like experiencing something of your pain at secondhand. I think it's a human thing to be concerned or worried about people that have pain, even if that's not necessarily the emotional response that you want from people. There'll be a lot of other things as well. Yeah.
Yeah, great, thank you. And there's another question I see on here about spaciousness and the expression of pain. And let me see what it says. Most healthcare professions have a set time allowed for appointments, and often that rushes the process. Having studied somatics, I realized how vital space is for beginning movement, for processing movement, for expressing how I feel. I don't know if anyone wants to comment to that the space and time kind of available to people, whether it's in healthcare settings to communicate their pain or in more kind of arts-based projects. Don't be shy.
I mean, with healthcare professionals, there is always a time limit. And I know with other work that I've done where you compare healthcare practice with complementary therapies, the thing that always comes out better is the amount of time that the therapist has with the person who they're seeing. So there are more movements now to trying to create space for people within healthcare settings, but it is a very time limited service.
Yeah, I suppose like if we're thinking about the value of arts practices as well, you know, that is potentially a space where you can be given more time. So Anna, were you going to say something?
Yeah, I think I was just going to say what you said, really, that there's something about arts practices that can offer that time or can look at ways of expanding the time that's available. I remember when I was talking to some of the pain practitioners that someone had done a study, and I'll put it in the chat, but that most diagnosis was done in the first 90 seconds of the interaction, or most kind of decision making was done in the first 90 seconds. So some extraordinary reduced time span for thinking about and listening to experiences of pain, and then other narrative approaches which allow, you know, rather than offering directed questions which might seem time saving, but actually allowing narrative or image-based experiences to be heard, and that actually that can take the same amount of time but be more effective. But I mean, we talked, Emma, about you know, a while back about how relatively cheap it would be to prescribe an artist for a year, you know, to give people time and space that isn't available in other contexts, or offers different ways in that might complement or make more use of the limited amount of time that might be available within the NHS settings. The artists are able to invest and offer and hold time and space for people in a way that isn't possible in other spaces, but can be really complementary to that to make it work more effectively.
Yeah, thank you. We're getting lots of questions. Oh yes, so wanting to hear more about strategies for working with persistent pain without focusing directly on the pain, as described by Anna and Kerry. Don't know if you want to say something about that. Yeah. Kerry as well, you're welcome. Yeah.
Yeah, sure. Oh, I could just see the chat that would be wonderful, an artist for you. Yes, that's a great idea. Yes, as I said earlier, participants in our project did find that really useful. So the focus was on generating creative practice on the part of the participants, whether that be creative practice via movement or via other means. A number of them were creative writers already, so they were very happy doing creative writing, but others not so much, but they did other kinds of practice as well. One of the first, as I said earlier, we always did paired prompts. I think one of the first sessions we asked people to draw a pain map. The image I showed earlier was my own pain map, but we did ask people to kind of sketch pain maps, also maps of repeated journeys that they took in their everyday lives, because something that we already had an awareness of but became acutely aware of over time was the myriad decisions it takes every day just to carry out routine activity, boring day to day, what might appear to be quite mundane activities that many able-bodied people don't even think about for very much at all.
Just to add to that, Kerry, I think there's something about, because we were dealing very directly with chronicity, with persistent pain, with pain that wasn't going to go. And so to go in with a very clear remit that what we are doing is we're going to make an artwork together. We're going to make an exhibition. That's my remit. Going in without any sense that I'm going to offer well-being, or I'm going to offer improvement, or we're going to do a tick list before and you're on 1, and when you leave my, working with me, you're going to be on 9. We're absolutely upfront that that's not the remit. The remit is to generate art. And there was something, I think, quite freeing in that, to take away the expectation that you have to get better, that somehow doing this work has to make you feel better, and if you don't have to, then what does that space offer you for exploration? What does taking that expectation off offer a process? And I think that's, again, something that art can do in a way that, obviously is very complicated in other contexts and isn't useful in other contexts, but we could do that.
Yeah, okay, great. Yeah. And I'm just looking back, there's lots of questions that were answered, but kind of bringing up, Ala was mentioning about interventions to improve communication about mental pain between Black and minority ethnic people and professionals working in psychiatric services, which is really interesting question. And someone asking about, has there been research done around that with dance practitioners? So yeah, lots of really interesting questions coming up there. I guess one other thing I wanted to ask about was we shared some of the movement scores from the Circling project in advance of the webinar. And I wanted to ask if any of the panel members had a chance to have a go and what their experience was. Or if any of the participants who are here also had tried it out and want to say anything about their experience. I mean, I found them really, really interesting. Yeah, and lots of questions came up around communication as well, because I did these solo. So I was like, I always had that thought in my head about communication. Am I communicating with someone just by virtue of moving in space, even if no one's here? Or is the space communicating with me, like one of the walks, feeling the ground come up to meet me, and just reflecting how the environment really shapes how we move as well? So, and the kind of memory walk and just things that I didn't expect to sort of come up as well. I found it really interesting. So I don't know if anyone else on the panel tried any of the scores and would like to say anything. But no pressure. Rob? I think Rob's busy typing.
Sorry.
That's fine. All right.
I tried it and found it a really interesting thing. It made me take notice of my environment in a slightly different way to the way that I would normally do that. And it made me think of, don't do it as much anymore, but I used to climb, sort of rock climb. And one of the joys of rock climbing was kind of like that intense noticing of the rock that you were actually on and its feel, and that was part of the joy of it. You were very close to the environment and were having to take notice of it. So actually walking, kind of like doing a circling component where in an area that I was used to walking through made me sort of take notice of what was happening to me and my body. So I really enjoyed it. Thank you very much.
Yeah, it was quite interesting as well that the focus wasn't on pain. And so I found my awareness kind of shifting around. Like, so I would, you know, the walk that I had to do twice to compare, I could notice the differences in my body, but I was also noticing the differences in the environment as well, which was interesting.
It was interesting when we were making those, because I would sort of panic and say to Kerry, well, but we haven't asked people to think about pain, you know, we're not framing it. And Kerry was very trusting and able to say, well, you know, just tell me not to worry, that would come, you know, that, you know, we're creating a space. And we were wondering the other day whether there was something about, you know, because Kerry has lived experience of chronic pain and I don't. So I have to kind of actively engage with that, you know, with my experience of pain, whereas Kerry is living with it. She doesn't have to go, oh, now I'm going to think about pain. You know, she's living with that as an ongoing and sometimes consuming events. I mean, I don't know if there is something to that or not, but it was interesting taking that leap and just allowing people that space. You know, that was newer for me.
Yes. Yeah.
And also, though, I think there is something to that, but that's how I always work with the Geopoetics work. I try to keep it open, just to open up possibilities and trust in the process, because the magic always happens. But that can be a bit of a nerve-wracking process at times too.
Yes. Well, I also wondered if you guys had questions for each other, like things that came up that you thought you'd like to ask each other on the panel too. Were there any themes that you thought, oh, that was shared, and you know, I'd like to know more about that?
For me, one of the interesting things that Toshio brought up was the differences in language and how the fact that the different languages express pain differently. And the fact that you can't necessarily translate the ideas of pain that we use in English to Japanese and vice versa. That was really interesting to me, almost in a similar way to how, you know, something known as the Russian blues, where Russia has light blue and dark blue completely distinct from one another, much like we have blue and green as different colors, and so they actually see those colors at least ever so slightly differently, but the way they describe those colors is different. And Toshio, you know, highlighted that pain also works that way across cultures, and so using visual or you know, using visual and sound cues might be better. And I would like to hear more about that from Toshio, his thoughts on how you might implement that in in a dance or in a somatic practice or even in a healthcare setting? How might you go about utilizing sound and visual prompts?
Yeah, if you want to unmute there, Toshio, and respond, that would be great.
The last, it's not a direct answer to the question, but the last week there was a talk, inaugural talk by the professor of Coventry University about motion bank. In a similar way, just I wondered whether there is any chronic pain bank, not medical description, but for today's type of things. Then perhaps you could describe. I mean, Bernie wrote in a chat before, if the children used a thin film and some sort. That is one thing, but that may relate to the, you know, ASMR, auto sensory meridian response. It's all about more like sensual, sexual sounds, but not about sexual or sensual sound, but more like a pain sound. If you start collecting, if you like, sometimes repetitive, going with your heartbeat, sometimes superficial, thin sound, sometimes very short, like high peak, big sound, or long background going on type. And gradually, if you accumulate, it may be quite sort of inter-culture. And it's language independent type of things.
Yeah, really interesting, because we were talking about, you know, say you have like a practitioner and a person who lives with pain, and then in between there's some way of kind of mapping and visualizing what the experience is and what helps over time. And then nearly that this has become like an encyclopedia. But I like what you're saying as well, it could be an online, like a bank of some kind too, you know. But I think that raises the question I wanted to bring up about research. And I don't know if anyone wants to speak to that a bit more. Like, how am I going to phrase this? But if there are challenges around communicating and pain is a very felt experience, like how can we enhance or continue research in this area of something that's so felt, embodied? And I suppose there's been some examples here today, but if anyone wanted to talk a bit more about the research methods and the challenges of that, that'd be welcome too, you know. Putting people on the spot here. There's also another question. Has any work been done on how witnessing a more able-bodied mover impacts someone whose movement is restricted by pain? Does anyone know about that? I think it's an interesting question, because I think a lot of the time we're seeing represented able-bodied people, and how does that affect you if you live with pain? I don't know, Kerry, were you going to respond to that?
Yeah. I haven't got a response for it, but Anna and I had a kind of dream little handbook project that was going to involve something along those lines. Do you remember, Anna?
Yeah, but yeah, Ways of Walking Together. It's the book that we'd imagined. And we wanted to commission 10 artists to create an artwork that creatively facilitated ways for differently able bodies to walk together. Because one of the big losses that people talked about was, I can't walk with my friends anymore. They walk at a different speed. I know when they're slowing down for me. I know when they're, you know, I feel like I'm holding people up. And that was a real source of grief for many. And so we were thinking of, you know, could, like, so it's an artwork, but it's a walk and it's a walk between two differently able bodies. And so if you were walking, if one body was walking backwards and one was forwards, well, you would be slower, and you'd be slower without it being, I'm doing you a favor, I'm making you feel different, I'm trying to slow my body down, you know. And that tension between bodies that can do different things, that came up all the time. And it's one that I think really needs meeting. You know, like, how can I work with that group of people when I can run and they can't run? And I want to run as one of the tasks. So how do I do that? And we spent a lot of time talking about that. You know, so I did run, and they were kind of laughing, and some of them were angry, and some of them, you know, were enjoying that dynamic, enjoying seeing someone run. And I was running with the girl from Glasgow online, so she was on the phone with me, and she can't run, or she can run for a bit, but then she has to lie down, but I could carry on running. And we just had this strange duet together of these different bodies. But there was something about the art process that allowed us to meet that really head on. I'm not articulating myself very clearly there, but
yeah, thank you. Yeah. And I actually also wanted to ask Rob if you're happy to respond, because I always think at our workshops, Rob has a really interesting perspective on the discussions that we've been having. So I don't know if there's anything you wanted to comment on from today, and the issue around communication as well.
Actually, I just popped something in the chat, which is when I was listening to Toshio talk about reserve. And I think as sociable creatures, we strive to express pain as best we can, whether it's physical or verbal, as a survival tool, to let the others in the clan or our family know that we need help, and it's a survival mechanism. And yet, for all of this brilliant work that we do, reserve and cultural conformity and politeness, you know, sort of, it just makes me think, why should we hold back on revealing pain and things like that? There's a huge sort of barrier there. And I think today has just reminded me that we are our own worst enemy in that way. And it's sort of about finding barriers to come over, to get over people's, you know, I'm shy to, as a person who deals with words, I've been shy of coming to, you know, the word is scary to me. So to take part in an event was a brave thing, and that's a really minor, sort of silly personal thing, but sort of there's the inertia is an issue as well. And I think that's what I find fascinating, how we combat inertia as well as miscommunication.
Nice. All right. Well, I know we have another prompt video from Rob, so I think we'd like to do that before we go. But I'm trying to see, were there any other questions I wanted to ask before we end? I mean, there were things that came up around the problems of representing pain and stereotypical ideas. So one of the things we had discussed with Rob was around the kinds of music people associate with pain and how to change that. And that's one thing that when you're working with the arts, you kind of have to kind of confront. And then, yeah, I suppose there was a question around, is communication the right word? So maybe if I ask each of you, what would your word be after today? So maybe I'll go around to each one of you at a time. So maybe starting with Bernie, is that communication the word for you, or what other word do you use? Oh, I can't hear you.
I think it's really tricky. And I think communication can be a good word, but it's an incomplete, it's incomplete. And I think maybe what we need to do is engage in some way. And that suggests that it's more equal and it's not based on just talking, because you can engage just by being very quiet, or by being very silly, or by being very serious, or by talking, or a million different ways. So, but I think if we use engage, it still doesn't work completely.
All right, engage maybe. What about you, Anna?
I'm going to go with making visible, but then I think I don't really want it to just be about the visible. It might be a felt sense, but yeah, something about revealing something of pain rather than communicating feels more comfortable.
Okay, something about revealing. And Kerry, did you have a word?
I think I'm going to say conversation. So recognizing the flawed impossibilities of perfect communication, even in the same language, let alone across languages.
Toshio, did you have a word that comes up, or are you happy with communication?
Communication is okay, but there is some purpose of doing things. The purpose is when do you feel that you have solved or you have achieved certain things. In my background, in the mental background, not actual, I have the good friend who have used similar sort of things in psychotherapy. Right? So psychotherapy is there's a patient and there is a doctor, and they communicate, and quite often they talk, but the objective is whether the patient feels better toward the end of the process. And I have that in my mind. So this is the communication, and that's the process.
Okay, yes.
Yeah.
So they having like an objective you're kind of working towards together.
Yes. So
yeah.
what do you want to achieve there?
Great.
Yeah.
And Rob, did you?
My word would be intimacy, because it's very deep, private, trusting, sort of safe place that needs to be created before we can communicate. So I think it's intimate, and there's something lovely about that.
Brilliant. And Sarah?
I guess a lot of the words have been said by now, but I think revealed is a nice one, because it's about, I guess, discussing. I think communication is a good word, but it's not just about communication. It's about effective communication, making sure that we can discuss pain and be allowed to feel it without ourselves feeling bad about allowing ourselves to feel it, I guess.
Great. Well, thank you for all your different perspectives. It's been really fascinating. I think we've just opened up lots of doors. So I hope it's been really interesting for everyone. So we're going to share the last prompt video now. It's kind of like a silent meditation, which is reflecting on the same question about, you know, what stays with you in terms of words at the end of this. So we'll share that, and then we'll say goodbye to you at the end. So I'll pass over to Kozer, who's going to share that now with no sound. Yeah. So thank you very much. Yes, Grace was asking no sound. We chose to do that one with sound because we thought it would be nice to have a silent meditation as our way of leaving you today. And so I hope you found a word or something to take with you. You're welcome to put your word in the chat or not. We will be sharing the recording and hopefully some of the chat in the conversation as well with you. We'll be putting this on our website, but also emailing with a follow-up with everyone who has registered to attend. Yes, sorry if you were lying down and you didn't have sound, but yes, it was just a meditation on your own words you take with you before you go. So thanks everyone for joining us. Thanks to all the panel members for sharing your work. Thanks to Koser, who's been working very hard in the background with all of the technical stuff, and Sarah, who's been looking after the chat and the Q&A. And thank you mostly for all of you for attending and inputting. So we really appreciate that. So I'll say goodbye to you all, and we'll be in touch soon. We have another webinar in July, I think it's the 16th, which is more about, we're going to launch a set of videos where we share actual somatic practices for pain. And we're going to be talking about moving online, which has been happening a lot during the pandemic. So I hope to see some of you there. And in the meantime, I'll say goodbye to you all. If you want to leave any comments, you can before you go. And I'll stay on maybe with the presenters for a few minutes while you all say goodbye. So thank you.